I've always been interested in science, even as a young child, and I like to interact with people, so I think that was sort of allowed me to naturally gravitate towards medicine in general. I actually thought I wanted to be a pediatrician at first, but when I was going through medical school and doing my obstetrics rotation, I really just fell in love with obstetrics, and mostly because there's no other field in medicine where you have two patients at once. There are times where what's good for the baby and what's good for the mom are in sync, and there are times where those needs are competing, and those are probably some of the most challenging conditions that we have to manage in our field. And so for me, that was really fascinating. And I've always had a passion for women's healthcare, because I think when you invest in women, you kind of have a ripple effect on families and communities and society as a whole. So all of those interplay of factors sort of led towards a natural gravitation to maternal fetal medicine.
My favorite thing about this job is being able to talk to people and give them information. I think that if I wasn't so interested in healthcare, I would actually be a teacher, because I love to be able to educate people about different things.
Not every decision that's good for one person will be good for another person, so I want them to feel confident that that's the decision that was best for them. So when they lay their head down on the pillow at night, they know in their hearts that that was the decision that was right.
Honest empathy cannot be faked. I mean, if you really care about somebody, then it's going to come through and you'll be able to feel it. Having gone through and counseled so many women on, unfortunately, bad findings, sometimes ends up in a miscarriage or a loss. But then having them come back to me for a subsequent pregnancy and saying like, oh, you know, I can't wait to see you, I can't wait to share this good news with you. It's very heartwarming.